diabetes, you must start the lifestyle measures at the age of 8, which is going to sustain. Whatever that they can practice should become the part of lifestyle. It's not something you do for 10 days, 15 days and forget it.
Practice.
You must imbibe it into your lifestyle. That's most important. And by 13 years, 13 and a half years, mostly your basic lifestyle, whims and fancies, likings, dislikings gets fixed. If you like tomato dal by 13 years, you will keep liking throughout life. If you don't like fish by 13 years, you will never like it in your lifetime. That's the usual, roughly, not necessarily. So, from 8 years to 13 years is very important to regulate the lifestyle of a person. We must understand and lead it towards just not that they try to cry, they try to shout, they try to resist if you don't get something which they like. But you should have your own ways of doing things. One day my wife started shouting at children, they are not eating chapati. So I just took the chapati, put 2 zeros and 1 zero here, took out little, it became Mickey Mouse and they started eating. Should have your own techniques to do that. And that's how children are just, how you train them, their mind gets trained. It's easy to meddle them at that point. You have to have little techniques. When adults, you have to show, most importantly, the adults should show a way, regular exercise, eating, which is healthy. I don't say that you just eat healthy and live whole your life without happiness or joy and die at the end. Not that. You have to have your own priorities. Okay? So, still, those healthy stuff, make it liking. And children, if you teach them from beginning, they get habituated early and they like. Many children don't eat salads because mothers don't offer them. So if you offer them and if it will become a habit, if you keep them to do things before the age of, at the age of 8, at least before the age of 13 and a half. So when it comes to treatment, is treatment really necessary? Really necessary, yes. Because one, those BMI above 37.5, they have a real disease and no lifestyle can bring them down unless their intention is very, very strong. Around 2% can have such intentions, can lose. But most of the times we resort earlier to bariatric surgeries, which just reduces the fat absorption, glucose absorption. Still, it is by far discouraged because it causes a lot of vitamin deficiencies, essential nutrient deficiencies, which have to supplement from outside. Still, they have some kind of weakness, and if they don't follow proper lifestyle, again they rebound all their weight. So, changing the lifestyle and attitude is most important. And coming to the drugs, there are many drugs now because obesity world over is a big business, is a big industry.
Hello.
There are many pills now. If you go to US, you have a lot of over-the-counter pills and so on. Most of the pills earlier, they were abandoned, they were banned because it increases your metabolic rate and it increases your heart rate and thus causing more irregular beating of the heart. And most of the drugs like phentermine, sibutramine and earlier drugs, they were banned because of the death rate is high if you use those drugs because of irregular heartbeats, if the metabolism is increases. So there are certain drugs now that doesn't increase metabolism. So whatever the fat, it allows that fat to get digested and then it tries to spend the fat. That's how it works. But that's how the drugs which increases metabolism works. But now people have seen from the other end. We are giving unnecessarily and we are trying to spend that. It is like something like our savings bank. You either deposit less or spend more. So somebody came and said, doctor, I don't have a savings account, I have a fixed deposit. So still it is a mobile condition. It is a dynamic condition in the body. It keeps changing to the blood, to the body, to and interacting. So there are certain drugs now. They reduce the appetite. They reduce the motility of the gut, and then it causes aversion to mainly when it is appetite. There are two things here. One is hunger. Second is appetite. Hunger is a natural physiological phenomenon. Our body needs energy. You get hungry. But appetite is something. Today is chicken biryani. No? They eat 2 times. Today is bendi dal I don't like. So it changes. That is the appetite for certain foods. So now the drugs focusing on this appetite factor. So there are many drugs that have started much earlier, like 1938, and later came the phentermines, which reduces appetite, and later came the amphetamine and so on. It increases the metabolic rate, and then this is phenylpropanolamine, also increases the rimonabant, sibutramine. All these increases the metabolic rate. And orlistat is one that reduces the absorption of fat, but only fat. Later we found that fat is not the entire thing that is responsible. It is most importantly the carbohydrate. Carbohydrate is the sugars, the maida we eat, the corn flour, cornflake, and the rice. The biggest problem is rice with us. So biryani. So we started using orlistat, but orlistat doesn't allow the fat to get absorbed. At least 50 to 60% of fat goes in the stool next day. But there's a lot of problems with that. The essential vitamin deficiencies, which are fat dependent vitamins, so vitamin A, D, E, K, they get deficient. That's one. 2, they get seepage of the fat to the undergarments or even the garments. We have seen many times when you give this, people come with great embarrassment using this medication. Then came recently lorcaserin also works, but it causes a lot of gastric cancer, so it is also abandoned. Now there is semaglutide and tirzepatide and retatrutide. These are the 3 drugs that are very promising. And semaglutide mainly controls blood pressure, it controls blood sugar, it reduces cardiovascular risk, it reduces inflammatory pathology deep inside, it improves the cholesterol levels, also it reduces weight from 5 to 15%. So at this point it is available in India, we are giving it. So you must have heard Wegovy and all that. They are injectable, still not available in India. It's also effective and reduces weight up to 20% of basic body weight. And recently came what is called tirzepatide. Is also people are bringing from Dubai, and I have been giving for the last 3-4 months. And the weight loss is tremendous. And there are instances some people lost up to 25% of it. It's 100 kg, it becomes 75 kg over 3 to 6 months. How long we have to use, we don't know at this point. But as long as you desire, if your targets, goals are of weight is reached, if your goals of diabetic control, other controls are reached, maybe you can improve your lifestyle and start at that point. At least 6 months to 1 year gives great benefits. And the next one is tirzepatide. This is the twin creatine. This is single creatine. This is twin creatine. There is tricreatine. Now retatrutide is also coming up in the next maybe in a year. It could reduce your body weight up to 30%. So somebody with 100 can become 75, 80, which is just phenomenal. And sustained is how best you utilize the drug in your life. Change your lifestyle, understand your weight and benefits of weight. It is not just weight, it is ABCD, adiposity based chronic disease. You understand the consequences of overweight and obesity. and thus you try to reverse the whole lot pathophysiological events, and thus you can have more longevity and also quality and quantity of and disease-free life. So thank you very much for your patient listening. I'll be happy if you have any questions.
Thank you so much, sir.